Hello, my name is Frank Walker, and I'm the clinic pharmacist for today. Are you Emily Lynch?
Yeah.
How are you today?
Well, I could be doing better. I guess you know why I'm here. Dr. Alexander said you would talk to me about my medication for my vaginal yeast infection.
That's right. Dr. Alexander prescribed a non-prescription medication called Monistat. You can buy it over the counter in any pharmacy or supermarket. I'm going to give you a sample to take home with you, but you'll need to go to your local pharmacy to buy some more. Do you know what Monistat is?
Well, I've seen commercials for it on TV. I've never had this problem before, yeast infection. This is so embarrassing.
Well, it's quite common. In fact, 3 out of 4 women will experience vaginal yeast infection, and there's no reason to be embarrassed. Dr. Alexander wants you to take Monistat 7 suppositories.
I don't take a pill?
No. You will insert a suppository using the applicator into your vagina as if you were inserting a tampon. It's a 100 milligram suppository.
How often do I insert it?
You need to insert a suppository using the applicator once nightly for 7 nights. This medication will help you to treat your yeast infection.
Is the medicine going to hurt?
No, the medicine should not hurt you, but you might feel some irritation or burning after inserting the suppository. These are only potential side effects, and I would recommend wearing a light panty liner as discharge from the suppositories can occur.
Is it going to get rid of the itch and the thick discharge that looks like cottage cheese?
Yes, it should. These are typical symptoms of a vaginal yeast infection.
I've never had a yeast infection. Is this considered a sexually transmitted disease?
No, it's not a sexually transmitted disease. You can relax.
Then how did I get it?
Well, certain changes in your environment can trigger an overgrowth of a naturally occurring fungus called Candida.
Fungus?
Relax. A lot of factors can trigger a yeast infection, like certain antibiotics, pregnancy, birth control pills, and menopause.
Well, I'm not pregnant or menopausal. I'm only 21, but I am on birth control pills. But I've been on the pill for 3 years, and I've never had a yeast infection.
Sometimes bubble baths, vaginal contraceptives, and tight clothes can trigger the growth of the fungus.
Really? Bubble bath? I got a new bottle of bubble bath recently. Maybe that's how I got it.
It could be. The good news is that you saw your doctor soon, and now you can start treating it.
Okay. Thanks for the info. Now I know to stay away from bubble bath. If I stop using the bubble bath, I'll be okay and not get another yeast infection?
Well, it's a good idea to stop using the bubble bath, and there are other things that women in general should do to prevent vaginitis and yeast infections. Try to avoid whirlpools and hot tubs. It's a good idea to avoid scented pads and tampons. They can irritate the vagina.
Can I still douche? I douche once in a while.
I wouldn't douche. Douching can actually cause vaginal infections. It certainly doesn't clear up infections.
Really? I didn't know that. I'll have to tell all my girlfriends.
I would recommend eating yogurt that contains active lactobacillus cultures. Lactobacillus is a good bacteria that is common in the vagina.
Are you serious? I had no idea. Wow, I've really learned a lot. Dr. Alexander didn't tell me any of this. He just said, take Monistat.
Well, I'm glad you've learned a lot. And don't forget to take the entire dosage. Finish the entire course of treatment, even if you start to feel better.
You mean finish all 7 suppositories?
That's right.
Will do. Thanks a lot.